Cannulation, or insertion of a peripheral access device, is a core skill in the 2018 NMC Standards for Nursing Education, and during your Care of the Acutely Unwell Adult module, you'll get to practice this here on campus. As part of this programme, we're going to talk through a practice scenario here on this short film to show you some of the best practices and some troubleshooting in this technique. One of the first steps with this procedure is to make sure that you have informed consent from your patient and to ensure they're happy for you to proceed, and also to check for allergies. Hello there, my name is Peter, I'm one of the nurses. Can I just check your name and date of birth, please?
James Burke, 14th of January 2003.
Thank you very much, James. And do you have any allergies at all?
Only hay fever.
Okay, that's good. So we need to put a little access device, a cannula, into your arm, in your vein. It might hurt a little bit, and the reason for that is because you're dehydrated and we have to give you some intravenous fluid. Would that be okay?
It's fine by me.
Thank you, James. As part of the procedure, it is really important to follow appropriate hand hygiene methods and also don PPE, such as gloves and apron. It is important to prepare equipment before proceeding with the patient, and it might be useful to take spares and include more than one access device. With IV cannulas, the bigger the number, the smaller the lumen. An extension device might be a useful piece of equipment to include if more than one IV is to run. A tourniquet to help find the vein that you would like to use. A 10mm flush following local policy. An appropriate dressing to enable you to conduct VIP scores and preserve the cannula, and skin preparation following local procedure. James, I just need to put a tourniquet on your arm to look for a vein. That involves a tight band going around the top of your arm. Would that be okay?
It's fine by me, yes.
Thank you. So when I'm putting the tourniquet on James's arm, I'm stretching out fully to allow for full tautness, crossing over at the top and then tucking in underneath. Applying the tourniquet in this way allows for quick release. Once the tourniquet has been applied, we can then look for an appropriate vein. With cannulation, it is important to start peripherally and work your way forward. As you can see here, we have some nice vein structures. The veins we're looking for are bouncy, non-rigid and quite straight, avoiding any junctures. Providing some skin traction will help with inserting the peripheral access device. Prior to insertion of the cannula, one final check of equipment will be useful, including priming an extension device or octopus if using 0.9% sodium chloride following local procedure. To insert the cannula, I've reapplied the tourniquet around 7 to 8 centimetres away from the insertion point. I'll repalpate the vein to ensure I'm happy, acknowledging the appropriate vein is bouncy, straight and avoiding any junctures. I will then prepare the skin following local policy and procedure using a hashtag approach, being sure not to repalpate the vein after the skin preparation has taken place. I will then choose the device depending on a number of things, including the gauge of the cannula, the flow rate, the size of the vessel, and the reason for its use, the rationale. I will hold the cannula along the bridge at the top here with my finger over the cap, removing the safety. I will then apply some skin traction and insert the device at around a 25 to 35 degree angle. I will observe a flashback in the chamber that lets us know that the cannula is sitting inside the vein. I will then retract the bridge whilst advancing the cap with my finger, ensuring the needle is brought out of the person while the peripheral access device, the lumen, is left in situ. I will then attach the octopus to the end that has been primed and flush the cannula after releasing the tourniquet. We'll check with the patient for any signs of pain and observe for any signs of infiltration. Once happy, we can secure the cannula in place, and a little tip for using the dressing is to prepare that in advance by folding back on the first bit, enabling these strips to be easily accessible once the cannula has been first inserted. I have predated the dressing in advance, and when applying the cannula dressing, I will ensure the bottom overlaps and then take the edge off the dressing, being careful with tender areas of skin. Finally, I will add the date and ensure the patient is happy with the procedure. So this brief video has looked at cannulation or IV access device insertion. We've started with obtaining patient consent, which needs to be freely given and informed, and we've looked at following local procedure as far as PPE and hand hygiene is concerned. When it comes to inserting the device, you need to make sure that you've assessed for vein health, making sure the vein is bouncy, non-rigid and straight. Also, we've looked at applying the tourniquet with troubleshooting and using a single-use tourniquet, and we've gone through the process of actually inserting the device, which you can look into in more detail with our partner site on clinicalskills.net. It's important that you check for things such as a reaction, the VIP score of the patient, and also allergies before you insert the device itself. In summary, cannulation is an invasive procedure, the most commonly performed worldwide, with 1 billion insertions taking place annually. It's a procedure that you're likely to complete as a registered practitioner and also as a student nurse, and practice makes perfect.